One of the commonest blood tests we do to check a woman's fertility is called an AMH level. AMH is an acronym for anti-Müllerian hormone. And this is a great test for checking your egg quality or your ovarian reserve. Let me explain some of this. Because part of the problem is women and doctors start getting obsessed with the number itself. And that's a big problem because remember, we're not treating numbers, we're treating patients. And just because you have a low AMH level doesn't mean that you're infertile. The reality is that lots of your friends could have two babies in their bedroom, have a low AMH level, but because they have enough sense not to go to a doctor, they don't know their AMH level is low. And the doctor obviously is extremely biased and prejudiced because, by definition, an infertility doctor doesn't see fertile patients, he only sees infertile women. So that if he sees an infertile woman who has a low AMH level, he puts two and two together and says, hey, that's the reason for your infertility. But often that may not be the reason. It could just be an incidental, irrelevant red herring. So don't panic just because your AMH level is low. Let's suppose your AMH level is low. That doesn't mean that you can't have a baby in your bedroom. You need to interpret any level in context. So remember, a low AMH level in a young woman has a very different connotation as compared to a low AMH level in an older woman. And also remember that you shouldn't interpret levels in isolation. You should also see whether you have a trend, whether there's a context, where you've done your AMH levels in the past. So that if you've done one AMH level, please, if it's low, always recheck it and retest it, ideally from a different laboratory to make sure that it is in fact low. Because you'll be surprised about the amount of variation there is from lab to lab. If your AMH level is low, that's still no reason to panic because an AMH level is a marker for ovarian reserve, but it's a biochemical marker. Along with checking your AMH level, you should do an ultrasound scan to check what is called an antral follicle count or an AFC level because that gives us biophysical information as to how many follicles there are in your ovary. So if you have a low AMH level but a normal antral follicle count, that's a very different prognosis from compared to a low AMH level with a low antral follicle count. You need to put all this information together and don't depend on your doctor to do it for you because if you find a good doctor, he will. If you don't find a good doctor, they'll cause you to worry and panic and cause a lot of anxiety. And this is especially true when you have an uncommunicative doctor who then forces you to go to Google to find information for yourself because the doctor is not sharing information for you. And then when you Google low AMH, you say, oh God, I'm never going to be able to have a baby. But that's not true. The good news is that even though we don't have any direct medical intervention for improving AMH levels, that doesn't mean that you can't get pregnant. There are lots of things we can do to help women with poor ovarian reserve. Let me explain a little bit of this. Please don't confuse poor ovarian reserve with poor ovarian response. Ovarian reserve is static. It's just a number, an antral follicle count or an AMH level. It just talks about potential. Ovarian response is dynamic, and that's much more valuable because that tells us actually what happens during the IVF cycle. Did your follicles grow or not? Were the eggs good or not? Did they fertilize or not? Did they form good quality embryos? So that even women with poor ovarian reserve can end up being good ovarian responders, provided you find a good clinic who can then tweak the super ovulation protocol for you. The tragedy today is that doctors don't bother to educate patients, they don't bother to sit down, they don't bother to explain the variables. And what's even worse is that they cheat patients because they tell patients, oh, you have poor ovarian reserve, that means your chance of getting pregnant are poor, you need to use donor eggs. Or the newest racket now is you have poor ovarian reserve, we'll do an ovarian stem cell rejuvenation. Sounds fancy, doesn't it? We will rejuvenate your eggs. We will give you new eggs by injecting stem cells or what's called ovarian PRP or platelet enriched plasma. Clever ways of fooling patients, clever ways of making a lot of money. But none of this stuff works. So don't allow bad doctors to take you for a ride. Make sure that you do your research and make sure that you're finding a good doctor who will be transparent, who will share information with you and do what's right for you. So you have peace of mind that you've received good quality medical care. I hope this was helpful. And as an IVF doctor, I take pride in sharing my knowledge with IVF patients to help you get the best possible medical care. If you have any questions, please feel free to email us and we'll be happy to create a video to answer your questions.